So welcome back to episode 45 or Taking Charge of My Cancer podcast. I have a great guest today as somebody who I've been spending the last 10 weeks, 40 hours and more a week. Her name is Theresa Eggleston. She's a physical therapy student from High Point University, and she is doing her internship here with me. This is a 12-week internship. She is on week 10. And then I'm going to let her kind of tell us a little bit about her and how she ended up landing here. So, Theresa, thank you so much for doing this with me today, and welcome.
Yeah, thank you for having me. Happy to do it.
Great. So you want to tell us a little bit about you?
Yeah, so I'm a third-year DPT student, like you said, from High Point University, which is in High Point, North Carolina. I'm originally from a small town in Wisconsin, Cedarburg, which is just north of Milwaukee. But I moved to North Carolina about 4 years ago because I knew I wanted to go to PT school and I wanted to be in a warmer climate. So, but yeah, I did my undergrad in Minnesota at Minnesota State-Mankato, where I got my bachelor's in science in exercise science with a minor in psychology, and I was on the pre-PT track. So, and then currently my plan is kind of to go into pelvic floor physical therapy after graduation, but also interested in oncology and lymphedema.
Okay, great. So you wanna to tell us a little bit about what is APK and what is that means as an undergrad, like APK, like exercise physiology?
Oh, yeah, absolutely. So a lot of it was just understanding like the basis behind exercise, understanding how to dose exercise. We did a lot of like VO2 max and submax testing, but really just understanding more that physiology of exercise and the benefits and how to progress exercises for patients.
Right.
There's not a lot that you can do with just the bachelor in exercise science, so it's really more of like a stepping stone
Yep.
degree. So you have to go on to get a certification to become an exercise physiologist. A lot of us were the pre-PT or OT track. So a lot of us knew that this was just our foundational knowledge, and then we were going to continue on into a graduate level degree.
Got you. Were you always planning to become a physical therapy, or how do you land in the path of PT?
Yeah, so originally, no. I always knew I wanted to do some form of healthcare, just because weirdly enough, no one in my like immediate family is in healthcare, but me, my brother, and my cousin are all I'm doing physical therapy. My brother did pharmacy, and then my cousin's doing occupational therapy. So somehow we all landed in the medical field. I think it's just due to our history. We had a lot of family members who had a lot of medical problems. So just getting exposed to that at a really young age just really set that path for all of us. Originally, though, I was thinking nursing. But I did want to do oncology nursing when I was in high school. So I got my CNA license when I was 17 and did that for a little bit. But then at orientation for college, when you had to decide your major, I looked at my parents and I said, just kidding, I'm not going to do nursing anymore. I think I want to do physical therapy. Because when I was doing my CNA internships, I would take patients to physical therapy and help the PT out a little bit, within my scope of practice as a CNA, but that's kind of where I got like my first introduction to physical therapy, other than, going to PT for myself in high school for various knee injuries. I
Got you.
think most of us in physical therapy have gone through it at some point.
Exactly. Very good. Well, I think that you will be a great colleague of mine next year when you graduate. So you've been doing awesome so far.
Oh, thank you.
So did you choose to do this oncology internship, or did the school offer this internship and you didn't know that was oncology? How was that path?
Yeah, so I picked it. I knew it was oncology and I wanted exposure to it, mainly because I didn't know much about oncology PT when I took it, and I wanted to get exposure, especially as a student, where you're still, it's more acceptable to, make mistakes and everything like that, and to really like learn on the job. Even though as a new grad, you're still going to be very entry level and have a lot to learn. I think it's a profession where you're continuously learning, right? But with pelvic health, it used to be more like that women's health. So a lot of people do pelvic oncology and lymphedema just because it kind of treats that whole person. I know, like my in service, I'm doing kind of breast cancer and pelvic floor PT to kind of look at that, especially people who are estrogen receptor positive, like how that can impact the pelvic floor. So I think it just gives you like a more comprehensive view of the person and be able to treat, multiple issues that come up through the breast cancer journey.
Excellent. And I'm going to dig more into what you just mentioned in a little bit. But
Okay.
how did you feel when you started this internship in regards your prep from a school and onto an oncology setting? I mean, again, you knew you wanted to do oncology to just learn something different, something more
Yep.
specialized. But when you land here, like, usually I send you guys a welcome package and kind of explain what's going to be like. But how do you feel that school prepare you to do this internship?
Yeah, I think they prepared me decently, but I also High Point does selectives or like an elective program. So every few semesters we pick courses we want to take based on our interests to kind of deep dive more into, not just the comprehensive overview of PT, but things that you're interested in. So I've done like pelvic health, but I also did an oncology selective. So it was 4 classes. We did leave some feedback because it was geared for the cohort above us, and they just knew there were some of us interested in my class, so they opened it up to us as well. So it didn't fit in our schedule as well as it did the class before us. So we just kind of had to like squeeze it into our schedule. I think there were about 15 people in my class who took it, which was really great to have great interest. But it was definitely geared more to those people who were third years, because I took it in my second year. So they all had a comprehensive understanding of lymphedema, more about the oncology, because we then had an oncology lecture in another class. So they had a little more like base knowledge. So everyone in my class was a little overwhelmed in the class because it was an information dump and it was 2 weekends in a row. So we were in class like I think 18 days in a row at that point.
Oh,
So
wow.
it was kind of like, yeah, at the end, I can't tell you what I learned, but I think it was just a really good like introduction to it, just kind of getting familiar with the terminology, the grading, the staging, and everything like that. And then yeah, we
sorry.
had one oncology lecture that was like a 4-hour lecture that just again kind of went over the grading, the staging, different chemotherapies.
Okay.
But I don't think it gives you a base knowledge, but then coming in and then actually having to work with the patients who are telling you about these different chemo drugs. It's no longer just a drug you have to recognize for a test, but you have to understand like how it impacts the system, contraindications, everything like that. So I think it gave me a base knowledge, but definitely it's been a learning process
I got you.
throughout the internship.
But you're lucky because I don't think of any other school, at least from the schools that come from the students who come here, and we have several schools throughout the country, that they have the opportunity that you guys have to do an elective, because even though I'm sure it was super overwhelming, but I can guarantee you when you start listening, when you came in here and you listen to your first breast cancer conference, and you listen these terminologies like, oh, deja vu, right? Oh, that I remember this and I remember that. So I think that is a huge help for that versus just the 4-hour lecture that most of the schools do in oncology.
Yeah.
And then maybe one lecture for lymphedema, and that's the extent of it. So,
Yeah, absolutely.
so
I
I,
definitely think it helped just because I had gotten it then twice. So that first one was like that first 4 days was a little overwhelming, but at least I knew the terms. And then that second time, it was more of understanding the terms, which really helped because a lot of my classmates who didn't take that oncology lecture when we had that test were overwhelmed. And those of us who had like the base knowledge were like, oh, let us help you. We kind of,
great.
have a little bit more of an understanding. Let me share this lecture that goes a little bit deeper into the staging, the grading, everything like that to kind of help you understand rather than just like a screenshot of like this is what T means, this is what N means.
Got you guys.
So yeah. And
Well,
then my school actually had a lymphedema. I had did a 3-week rotation with a lymphedema therapist, which also was really helpful coming into this. Just again, didn't know much about it when I went in because we hadn't had our lymphedema lecture when I went into that internship, but I got a lot of hands-on knowledge. And then the the PT who taught our class lymphedema was my CI. So
okay, great, awesome. So you already came with great tools, and that's again a great advantage versus other students. Like, I have another couple of students right now with me that they didn't have that, and certainly, gets more overwhelmed as you learn in this process. But how do you feel at this point? You've been here for like 10 weeks. How do you feel now versus the Theresa that came in 10 weeks ago?
I feel a lot better. I think I'll always feel like there's more to learn because with physical therapy, with oncology, it's just an ever growing field. So you're never going to know. And there was this one quote where it was like, when you're like complacent, you're not helping your patients. So like if you're no longer learning new information, then we're doing a disservice to people because information is always changing. But I think I have more of a like base knowledge. I feel much more comfortable like being able to treat patients. There's the occasional who's a little bit more complex where I feel like I still want to ask you questions and get your advice. But I feel like generally, like especially more with that breast cancer, which is what we see a lot of in the head and neck, that I can do a lot more treatments and feel a lot more comfortable being independent, asking those subjective questions, kind of pivoting to address each individual's impairments for the day.
Yep.
But yeah, there's still a lot to learn. Absolutely.
Yeah, but I'm telling you, I one thing that I love to be an educator, and and being so involved with the students is, number one, keep me on my toes, right? Because I need to stay up with the updates. So and as you teaching, then you really kind of like become more an expert, because I need to stay on my toes to be able to give you guys the right information. But it is really grateful, and it is really rewarding to see the growth. So, in the beginning, it's like, okay, we're doing ABC, and I have to kind of, make sure that you guys are doing it right. And then it start to just kind of like start to winging away from like, okay, that's your patient, figure it out what you want to do and what is ways to do it. And again, I'm there to say, well, that's a great idea, but we can use these other tools to make it even better. And always to see what's the best for patient care. That's kind of my philosophy, but that's great. So if you have 3 valuable tips that you will give to a patient that is going through cancer treatments, what that will be?
Okay. Yeah, that's a great question. I think the first one that I've learned is continue to keep living your life. Like, don't put your life on pause because you have cancer. Like, still do the things you want to do, try new things. I think of some of the patients who come in and they're very anxious, and every little thing, they're like, what is this? Versus like some patients we have who are still like taking care of their kids, like really haven't changed much of their life and they're doing great, and they're not sitting down as much and thinking like every little twinge could be something. So I think everyone has, every day we all are going to have different aches and pains in our body. And I will say with cancer, like I definitely think one of the like silver linings of it is it definitely makes you more in tune with your body. But yeah, keep active, keep moving, do the things you want to do, especially like we talk a lot about is exercise is very beneficial. So get out, do the things you want to do. And that would be like my first one. So don't just like put your life on pause because you have cancer. Keep going. The second one I think is like having a great support system. But knowing that you have to put yourself first too. So sometimes we have patients who kind of talk about like I'm doing this for my husband when they're talking about like especially with breast, like any type of reconstruction. So I know we've had this conversation a lot that it has to be your journey. So what do you want out of it? Because you're the one who has to look in the mirror and be comfortable with yourself. So if you want that reconstruction for you, then I would say go for it. But if you don't want it, then your partner should be there to support you no matter what your decision. And then my third is find an awesome physical therapist to work with you. Highly recommend the UF Med Plaza team.
Thank you. Yes, that's important. And you mentioned rehab, and then rehab in cancer has been growing, and it's a totally growing area. I mean, to the point that we just did a APTA, oncologist board certification. It started about 4 years ago, so recently versus the other specialty board certifications that we have through the APTA. And then on top of that, was not that many places that had an oncology residency. Is growing more, and that's kind of my goal at one point here, is to be able to develop that. But really, it's just it's such a great part of it that people don't recognize that, and even some institutions and bigger institutions don't get rehab or PT so involved with their oncology.
Oh yeah.
Procedures. And I've been, doing some national lectures and even going and visit places. And I'm just amazed how great our program is if I compare with other institutions, right? Because we do this prospective surveillance, secondary breast lymphedema surveillance program. And as well, try to really be seeing the patients as early as possible, if we can, for pre-op on the head and neck cancer patients, or bone marrow transplant pre-ops, lung pre-ops, whatever we can do to try to really prepare patients for that surgery that is coming, for that chemo that is coming. And the higher level of performance you are, or the stronger you are, the easy those procedures are going to be, right? So you're going to bounce back faster from surgery. You're going to hopefully have less secondary effects going through chemo. So I think that our field is growing on that area, but we need people like you, which is your students, who are going to be our future colleagues, who continue expanding the wings throughout and really educating physicians and educating hospital systems or healthcare systems about, we need to just be part of it, period. Like, we're as important as the medical oncology is, or as the radiation oncology is. And when I have patients from other institutions that didn't get exposed to it, or we have patients who have recurrence, and then 10 years ago, they're like, I never did any of this ever. And is making a huge difference now versus when I didn't do anything about it, right? And they perhaps they didn't have this experience because they didn't do anything about it. So it is great that we have students like you that are driven and really interested in all these other specialties. And the combination, you're right, we'll talk more a little bit about your pelvic health interests, but it's a huge correlation with, again, swelling and lymphedema and a lot of the pelvic health therapies out there. I think that the lymphatic system is as important as any other system. And I think that they need to try to improve their education and be able to really develop better tools of treatments to address the lymphatic system on top of everything else they do with the pelvic floor patients. So I think the combination of both worlds are really going to bring you a lot of opportunity out there to just really market yourself out and really try to, teach your colleagues, even if they have more experience than you, about how that part of that lymphatic system is as you treat pelvic floor. So that's
I wish physical therapy school focused more on the lymphatic system. You get maybe 2 lectures. We learned one in CVP, or cardiovascular pulmonary course. That's just a quick overview of this is what the lymphatic system is, and then one lecture that's here's lymphedema, here's a quick treatment option. But then working with patients, it's so much more complex than that.
Exactly.
And we were looking at those stats where if you don't do those baseline measurements, 40 to 60% of people are being misdiagnosed. So kind of like you were talking about, those pre-op and baseline measurements are so vital to really make the best clinical decisions and know what your patient is presenting with.
Exactly. And the sad part is not just happen on physical therapy. I was just talking with one of the physical rehabilitation physicians just this week. I was interviewing for another of the episodes of the podcast, and it's the same frustration, right? I mean, she actually became a CLT. So she was able to really learn more about the lymphatic system because in medical school, they just got really brief of it. So her interest is in cancer rehab and the lymphatic system and lymphatic, not just lymphedema, but any lymphatic disease. So she needed more about the lymphatic system. So she just put herself through a whole CLT, and it's amazing. So it's I just cannot tell you how much I learned and how much value that gives me to be able to treat these patients in the best possible way. So So that's really cool that you're kind of looking into both. How about what is the most painful lesson that you have learned in this journey treating oncology patients?
I think it's just really doing more of like the deep dive into chart review. With more like the outpatient that I've worked with in the past, it was just like a lot more like superficial chart review, just what did you do last time? How are you progressing it? But with these patients, they usually have so much going on that you really have to go look at other providers' notes and get used to different formatting. Like we kind of just learn how to read PT notes, right? But looking at speech, radiology, ER reports, everything like that. Because even like small bits of information can really help, pivot your plan of care, and then just really like monitoring patients. This internship has definitely kept me on my toes. Um, people having seizures, things like that. So things like that. But I think it's only made me, better and feel more confident, as a student, to be able to enter the workforce and feel like I can still keep my patients safe and notice some of those signs and symptoms. Before this internship, I hadn't referred anyone out for any type of red flag, and I feel like it's almost a weekly occurrence. So,
Yeah, yeah, exactly. And then we really start to looking at the patient. So even though when I used to do ortho, my whole philosophy always has been you gotta be looking at the patient as a whole. It's not just the shoulder, it's not that the elbow, it's not
oh,
just
yeah.
the neck. It is like what else we need to give them information. And perhaps I'm not the expert in nutrition and I'm not the expert in psychology, but that doesn't mean that if we identify situations like that, we need to be referring out or for mental health care. That's super important because in any of us right now how this world is, that's very it's
Yeah.
crazy what's going on out there. So all of us really, I believe, need some kind of like either meditation, some kind of like really taking care of yourself and your mind through different ways, and that, like I said before, can be acupuncture, can be meditation, can be exercising, can be actually going for counseling, can be even going for actually medication to control your anxiety and your depression. And this is just somebody with no cancer. So imagine when the cancer word comes to you, and then it's like, okay, now I'm dealing with something different that really just totally pivot my life.
Yeah.
And it is like a constant, then it's going to always be there with you, even if you're a survivor, even if you are 20 years out. It's always in the back of your mind. When I need this test, when do I need to do this? I'm feeling this is something normal that I just hurt my shoulder because I was working out, or this is something new, I need to go see the doctor. So I think that these patients, more than anybody else, really definitely needs to continue a coaching program or counseling, and somebody who kind of stay there to help them
Yeah.
to go through all these processes. So
I
okay.
agree. I think the world's crazy, and I think we could all benefit from a not just a physical therapist, but kind of that cognitive behavioral therapy. Someone, like a third party who just is there to talk to you, give you advice.
Yep, absolutely. Yep. There's anything that you have that will be of value for our audience, and will you share that with us?
Oh, that's a good question. Yeah, I would say, kind of everything we've talked about has been a good overview, but really like listening to your body and knowing when you need help, reaching out, whether that's going to the doctor, like we just talked about cognitive behavioral therapy. But the world's crazy, and we need to all find time to just take care of ourselves, put ourselves first. I think we live in a society where it's very much like focus on others and put yourself last. And I know we've had this talk about like for me to set boundaries because I'm terrible at that. I would rather just like do everything and make sure it's done. But I think overall, as a society, we need to focus more on putting ourselves first and focusing on our health and also our posture. Because even right now, I'm sitting hunched over a computer, and I tell patients like every day when they come in and they're like, "Oh, my shoulders hurt." And I'm like, "Okay, let's work on our posture," because we're all just looking at our computer and our phone. So, big thing, focus on yourself and, periodically check in, roll your shoulders back, sit up tall.
Okay. How can people find you?
Oh, yeah. So, I'm on LinkedIn. I believe it's just my name. So Theresa Eggleston. Um, it'll be on the podcast, I believe. It's kind of the last name's a little confusing, but
Right. I'll put it
and
on
then
podcast notes. Yeah.
yeah, I'm on Facebook, and then I'm also on Instagram. My Instagram is just my first name, Theresa, Theresa, and then NN221.
Okay.
And it has a picture of me and my dog. She's the star of the show.
Okay, great. Is any books that you will recommend to the audience and why?
Yeah, so yeah, I saw when you sent that over. So the first book that I always recommend to people, so I always butcher this author's last name, so I apologize, but it's called Small Great Things by Jodi Picoult. I'm so sorry, I probably butchered her last name, but it does talk about healthcare, and it kind of talks about more of like it goes on a little bit deeper dive of like racial indifferences in the country. So it was kind of hard to read at points, but I think it was a very like valuable book to read, and it gave me a lot of insight just as a provider because it kind of follows a nurse who is accused of like negligence,
Okay.
and it follows her journey and then the people on the other side. So I think it just gives both sides of like a provider and a patient. And it's just a really great book. The other book I read recently that I really liked was called Atomic Habits. I tell it to patients a lot, like I give them pieces of advice just because we want them to be compliant with their exercises. So it just talks about ways to incorporate new habits into things you already do. We're all already doing a million things a day. So when we're trying to add, one or two things from physical therapy, like how can we try to incorporate into their lifestyle so it's not something additional, but that we can, seamlessly include it. So I think those are some really good book recommendations that I really enjoyed. And the audiobook was great for Atomic Habits.
Okay, awesome. And then if you can just send those to me, and then again I can put it on the notes on the podcast.
Yeah,
Um,
absolutely.
Now, I want to close up with you just mentioned in the beginning about breast cancer and pelvic floor.
Oh,
So
yeah.
just kind of go deep a little bit on that. Like, how do you feel like a pelvic floor therapist can help, or like, sorry, a pelvic floor therapist can help a patient who had breast cancer if they don't have any symptoms, meaning, if I'm thinking I'm going to go to a pelvic floor therapist is because I either have, vaginal pain or incontinence,
Yeah.
or, and that's pretty much kind of like the reasons. But if I don't have any of those symptoms, why should I go and see a pelvic therapist if I've been diagnosed with breast cancer?
Yeah, absolutely. I think that's a great question. I think it's kind of similar to what we do with the baseline lymphedema, but just knowing where your pelvic floor muscles are at before you go through all of this. Because if you think about like after menopause, we have those dips in hormones, and that's when a lot of that vaginal pain, the incontinence starts because a lot of those muscles are fed by estrogen and progesterone. So when we have a dip in those, it changes that muscle function, which can cause tightness, which causes pain, pain with urination, pain with sex, everything like that. So I think knowing your baseline and also getting an understanding of what's to come. So having the education from a pelvic floor physical therapist, like I said, I'm doing my in-service on it. So I'm still doing some research, but the research I found so far has really talked about most breast cancer patients really wish they would have been told more about what was going to go on with their pelvic floor, what to expect, and had resources so they knew if they had those symptoms, who to reach out to. Because I think pelvic floor, kind of like oncology, is still a very new and growing field. So it's not as well out there in the world. So just kind of knowing that those resources exist and who you can reach out to should you start to feel those symptoms, and then what you can do to kind of help work with that, whether that's seeing, a pelvic floor physical therapist, whether that's just getting some, type of cream. One that I've been reading about is like a testosterone cream instead of an estrogen one, just because if your cancer is being fed by the estrogen receptor and then you're on inhibitors, like we don't want to introduce more of it to your body, but there are other ways that we can kind of help and work on some of that muscle tightness so that you can still do all those things, still, go about your day without incontinence and then not have pain in the vaginal region.
Okay, awesome. Oh my God, we can continue talking for another 30 minutes if we need to,
Oh,
but
yes.
I have to let you go so we can get back in the clinic. But
Yes.
Thank you so much for doing this. Has been really a real pleasure having you for the last 10 weeks. I know we have 2 more to go on. I really will miss you, and I'm sure everybody else in the clinic will miss you as well. But
Yeah, it's been the best experience.
that's awesome. And I know we'll continue in touch. And like I love to continue being in touch with all the my students or ex-students that are hearing this and they are in the oncology world. I love every time that any of you guys reach out to me and it's like, hey, I need an advice for this, or guess what I'm doing now, or I'm planning to start a program. So just really kind of like made my heart fill out even more just because that's exactly what I want to do. I really wanted to expand all my wings out there. Like, let's make sure that we get covered all over so I can
Oh
say,
yeah.
oh, I know somebody in North Carolina that can see you. And
Look
then,
at that.
so yeah. So, but thank you again for doing this with me today.
Yeah, thank you for having me.
Absolutely. You have a great rest of the week.
Thank you, you as well.
Okay, bye.
Bye.